But it's in these professional development courses, the change for me is there's always like a small handful of people that are very opinionated and very loud, and they want everybody to share their same opinion. And they get quite upset with you if you have any kind of different alternative points of view. And so like I'm sitting there listening to the loudest peer in the room talk, and I'm kind of noticing that I'm not the only person in the room because of my area. Like, I'm not the only school counselor who thinks and feels the way I do. I'm not. I'm around a bunch of other reasonably moderates, independents, conservatives, libertarians, who don't necessarily agree with the opinions, but we're all just sitting there kind of really quiet. We just nod our heads and go, yeah, okay, and then go on about our lives.
But there's a platform at one point where I would go to get all of my CEs. So once you get licensed, you have to get continuing education credits, right? So every 2 years, you have to resubmit licensure, and you have to get like 40 hours of continuing education, online courses, in-person trainings, like that. So there was this platform that I was using to get all my CEs. I would download all these online courses for the extra credits that I needed outside of the in-person trainings, right? So I needed like, I don't know, a handful of them. So I get on the site, I'm looking for a few more trainings. And I'm not exaggerating. This was the last time I submitted my license. So this was, I don't know, been a year and a half, probably almost 2 years ago. So I log on, and I'm not exaggerating. It was over 90% of all of the possible trainings had something to do with race, gender.
Wow.
School counseling shouldn't be political, but like what we're doing in public schools shouldn't be political. We should be providing basic education to the public, children of the public. I don't think that therapy should be political. I don't want therapy to be political. I have really liberal clients. I have really conservative clients. I have Christian clients. I have atheist clients. I have Buddhists. Like everybody, I love working with the great group of diverse people that I get to work with. But it's like in these trainings, people are only one group of people who are not apolitical are trying to take over the conversation and make it political.
It's just pointless. It's just, and it's not anything. They're not teaching you anything. They're just grandstanding. They're not, there's no value to the trainings at all.
I've heard from a number of therapists that a lot of the kind of political indoctrination after you've graduated comes from your continuing education credits. What have you seen in that regard?
I would say you could avoid it to a certain degree. I think that is true. So say you work for a large agency, there are certain things that your large agency is going to say, and this will happen and this will happen. And they're trying to create kind of a cookie cutter system, like whatever system you work for, this is what we do. So there is a certain amount of indoctrination that's going to happen in that. So that's probably more organization specific versus private practice specific. Like your hospital is going to work this way, or your psychiatric facility is going to work this way. I think in private practice, you have the ability to kind of pick and choose what you're looking for.
We stopped offering counter opinions, or we never began. Like for some reason, we don't offer counter alternative points of view. And one group of people feels really comfortable sharing and expressing their point of view, and you're not allowed to have a different point of view, or they get upset with you if you suggest an alternative point of view. So I think people who aren't super radical, people who are moderate, people who are libertarian, people who are conservative, we just kind of sit there and keep our views to ourselves.
I could even understand if the training was like, if the training was like, hey, you want to be a multicultural counselor, here are some important things to know if you have a client that's gay, or you have a client that's Hispanic. Here are some things to consider. Here's some research you could do. These are some of the things to understand. In my grad program, there was like one class on that, and I thought it was really helpful because like they had some DVDs that I would watch, and it would be like some things to consider if your client's Hispanic. And I was like, oh, I didn't even consider that. Like I didn't think about that. And they gave some statistics and some helpful information. But now even that's considered racist because now you're like stereotyping. So they're not giving you any valuable information. They're literally just grandstanding. They're just people talking about the problem with all of these areas of like, this is the problem with this, and this is the problem with that, and that's racist, and that's misogynist, and that's it. And I'm like, are we learning anything? And I'm literally just sitting there banging my head on the table. Like it was so pointless. And so it is so prominent. It's so prominent. It's really unfortunate.
I chose to take a kind of a year-long training course that's a more in-depth into a certain psychological theory. Wonderful class, great therapy techniques that I've been able to use with really good success in my practice. And it, like, once again, it's not teacher driven in my area. It's peer driven. I'm sitting there on the very first day of class, and I'm in between two people, and somehow, this had nothing to do with the topic of the class, but the topic of climate justice comes up between the two of them. And I'm like, this is weird. What are we talking about? This is a therapy class. What are we talking about? Climate justice. And like, both of them were saying that we should limit people's freedoms to achieve climate justice. And I'm like, what on earth? Like, where am I? And then both of them were like happy to admit to each other that they were communist. And I'm like, what room have I stepped into? This is not, so I really got taken back. Like, it's the very first time I've ever had this experience. And here I am sitting between two people who are very happy to share and espouse and try to get everybody to come to their side of having communist views to achieve climate justice.
So like I offer a number of like CEUs and things that I do in my local community, and all of them are pretty central. I don't lean politically one way or the other, to be honest. So I think that CEUs can lean politically, but I think you have the ability to weasel those out if you want to.
It was an interesting conversation, and I did push back a little bit. I could see the look that I was getting of like, I don't even know how to describe it, of like, oh, it was almost like a reprimand, I guess is how, like you're not a quality therapist if you don't hold these views.
Communist views?
Yes.
When I went to the professional training and was told that whiteness is an infection. Did I tell you about this?
I don't think so.
Okay. So I went to a professional.
How are we going to, rid ourselves of this plague?
Yes, I know. Well, I think the implications are clear.
Yeah.
Yeah, I went to psychodrama training because I'm so curious. It's such a powerful process. I've seen it in action. And one of the I don't know if he was the founder, but one of the early advocates and trainers, he was doing a workshop. And so I went to it. It was online. And he was talking about the principles of psychodrama. And he said, oh, and as we know, whiteness is an infection. And it was just an offhand comment. And everyone was like, yeah. And it was just, how often I've experienced that in my life. But then I wrote about it in a critical thinking Facebook group. And I said, y'all, whiteness is an infection. Like, I'm hearing this in this training that's not DEI. It is psychodrama. And a woman got really upset with me. She called me a nationalist, a Christian nationalist, for being upset. And that it was just, I can't even make sense of it. But it was the first time that someone, like, I think you and I interacted about it on X, but it was the first time someone had directly accused me of being some crazy thing.
Yeah.
And I thought, I can put anything out there that I feel like is sensible and balanced. Like, we probably shouldn't call races infections. And it's going to be interpreted on whoever's agenda, if it's religiously interpreted.
So I'm taking this class. I knew very little bit about it. I was just curious. Was looking for a community of therapists because I get really kind of bored and lonely in private practice by myself. And then a good handful of them were like socialist, and two of them were like full on communist. And I'm like, I have just walked into the wrong room.
I think, to me, I'm like, that doesn't surprise me at all. I know exactly that type of setting, but I feel like a lot of people, it would sound bizarre for you to describe this setting where it's far easier to come out as a communist than a conservative,
And that is kind of what has struck me and motivated with me since.
People saying that conservatives should not be therapists.
Yeah, I see that all the time. I see it online. There's always any CEU I've ever taken. So because I do a lot of perinatal stuff, like I've taken a lot of perinatal CEUs, pregnancy CEUs, inevitably, and like I even did one recently where like they had to do the spiel in the beginning of like, oh, like people with uteruses, or like, this is not going to be like gender specific. And I was like, not gender specific, like we're talking about dads, because like that makes sense to me. But like, and then everyone in there is like, well, if you can't use the right, like, we're so appreciative that you do this. Like, we're so appreciative that you're like being non-binary, or like, and I'm like, this is about women. Like, this is about women that are pregnant, and like the dads, and like this is like, it was supposed to be a grief and loss one, so it was on like stillbirth and loss, and I was like, this is a pretty uniquely female thing that they go through. Again, the dads are part of it, but like they're not the ones with the baby in them, and like it was just so off-putting. I had a hard time concentrating after that. If you It's one of those things where like often, because there's so many people on it, because they're usually like the forum where it's like you go on and you're not actually looking at anybody, like it's just them, and there's a chat bar, that like there's not even really a place to be like, what about this? So like I often don't admittedly say anything, which is like a little cowardly of me, but it's like I'm not going to change anybody's mind in the CEU.
For example, Vermont just passed a law that in order to get and maintain your license, you have to have 1 credit hour or 1 credit of continuing education in anti-oppression and cultural humility, which, boy, those sound great, don't they? But when you look beneath the surface, you find that cultural humility means setting aside your individuality and accepting uncritically someone else's reality. It's essentially introjection. Now, we want to replace your beliefs with our beliefs, and if you don't do that, you're not humble, or you're not a good person. So anyway, what we're going to do at the Society for the Ethical Practice of Psychotherapy. Oh, and by the way, the Vermont law stipulates that this training must be real time and synchronous. And the reason that they want to do that is for the exact reason that you started out asking me about the group process with professors. The reason they want this in real time, and you can't just go in and look at some slides on cultural humility or something, is they want to take advantage of the group process to shut down the process of critical believing and start the process of critical thinking, to shut down the process of critical thinking and to start the process of uncritical believing. You need to have a group process there pressuring a person. That's how the introjection takes place. So this law stipulates that it has to be real time.
We feel uncomfortable speaking up, but these other students who are like happily admitting to being full-blown communist and having that agenda and using it to inform their therapy practice, that struck me as really interesting. Why do they get to voice their opinions so freely, but when I voice my opinion, I get a look of reprimand?
Yeah.
And that has what set with me and struck me, and I haven't been able to get it out of my head or my system. It's like, okay, so we've entered a world where you can be a proud communist, but I have to be a closet conservative. I'm not comfortable living in that world. So what do I need to do to change it?
I quit the ACA because they kept trying to send me all these things where like, these are all the CEs to bring it back to the CE. I really got off topic there for a second.
You're good.
I was in the Facebook group, and there was one that was like kink and healing, and I was like, what is that? Like, I want to take ones on like perinatal and like stuff like integrative, like how do you help with chronic illness and depression, or like things that are actually going to be useful. And it seems like they're all just either ethics and paperwork or like gender and sexuality type things. I'm like,
I got this feeling of like, you can't really be a good therapist if you don't automatically adopt a bunch of extremist kind of views, or like it was like it felt like a reprimand is what I would like,
Yeah.
And I just disagree with that. I think that there's room in the therapy world and in practice for therapists of all political opinions and religious opinions. And I think that like that kind of availability of providers that have a bunch of like openness to new ideas and not rigid black and white thinking is the mark of a good therapist.
So you're saying we should allow people to become therapists even if their politics are to the right of Stalin?
See, that's where my libertarian sense fails me. It's like, oh no, yeah, I can't do that.
I don't know. I mean, it's one of the reasons why I didn't follow through with like the perinatal mental health certification. Like I couldn't get past They kept saying like chest feeding, yeah, like all those euphemisms for mom, women, and I was like, I don't know if I can get certified in something and like back this up. Like I don't want to give them my money.
And then as soon, like very first class, right out the gate, politically activist therapists announce their politically activist views that aren't really relevant to the class at all. And then it's like, okay, we've set the tone. These are the views. And then the rest of the conservative therapists in the room are like, okay, we're just going to keep our mouth shut and keep our head down and go on about business as usual. And y'all have fun with that.
You said it's a social taboo to talk about a lot of this stuff, but there is one place where it is acceptable and welcome to talk about that, and that's the Open Therapy Institute.
Yeah, thanks.
So that was a good little, you like that lead in?
Thank you. I like that. That's great. Thank you.
You hear about race, gender, sexuality, but there's a lot of issues that you guys cover. And I'm wondering if you could just briefly give like a broad overview of all, that kind of.
Well, I'll give you I think about what we're talking about here, just to reflect on what we've just been talking about. Everybody who's faced discrimination in a job because of DEI, everyone who's had school programs or work programs that have been aggressive or attacking, or their kids have, and this stuff is on the news, it's in the media, and anybody it makes sense that this stuff is going to have psychological impacts on people, massive psychological impact.
What we're doing is we're going to provide sort of a counter training that's titled Healthy and Unhealthy Approaches to Anti-Oppression at Cultural Humility. And so that's what the Society for the Ethical Practice of Psychotherapy is there to do. It's there to help reaffirm Enlightenment principles as the guiding star for the profession of psychotherapy, to move back towards truth orientation and away from a power orientation.
We want to document all of the issues people are experiencing. We had a great lecture on men falsely accused of sexual misconduct. We had a great workshop on anti-male bias and aggression. We had a workshop on anti-white bias and aggression. We've had workshops on faith-based issues and secular bias and mental health. We had a talk on abortion regret and women who have an abortion and then regret it, often with really heart-wrenching feelings associated with it. Anything that's socially taboo that people have strong feelings about is fodder for psychotherapy. And it's shocking that our field actually doesn't have robust literature on these topics, doesn't have trainings on these topics. And if you have one of these experiences and you want to find a therapist and you look online and 90% of them are woke and their pronouns are the first thing after their name and their bio, where are you going to find somebody? So we need to train therapists who can really foster open dialogue on all of these topics. And part of that is developing a literature and having training on all these issues. And there's more than people. I mean, it's like, I was just talking to somebody about like incels, people who identify as incels or don't, or what, it's like, or failure to launch in young men, couples issues, dating issues, family issues, conflict around politics. There's so many issues. And most of these issues have zero literature or very little literature. And on most of these issues, when the Open Therapy Institute has a training on them, it's the first training that's ever happened anywhere in the mental health field. It's been the one that we've done. And we get emails from patients pretty regularly. We're looking for a therapist for this issue. And it's like, they don't know where to go. There's nowhere, they look on Psychology Today. Is the therapist going to even be able to listen to us on this topic? Or are they going to react judgmentally? But even if they're a nice person and they're willing to talk to us, do they know anything about it? Have they ever read anything about it? Do they have anything to offer? Or are they just going to be a nice listener while you describe your problem and then they don't help? So I think with all the people who self-censor, we had a whole 4 talks in a workshop about censorship, how it could contribute to symptoms, what treatments are likely to be effective for that population, what's the rationale for censorship, how it comes into the therapy room. We need all of this. We need case studies. We need empirical studies. It's like, so it's just issue after issue. I think the field is neglecting, and we want to document these things, train therapists to really do this work.
I feel like you could just, on a search of Google Scholar or something, you could probably pull up dozens of articles on microaggressions against non-binary Latinx professors, something like that.
Right.
But all these issues you're talking about, there's just a complete lack of, that's just stunning.
and they affect millions and millions of people. I mean, I really think, and we don't have data on this, but I think that people with these concerns, we could call them socio-politically overlooked patients. Those patients are the most poorly served patients in the country, and they very well might well be a majority of people with mental illness. I mean, it's so huge, and it's like, some of them luck out. They get a therapist who's sympathetic and able to engage with them on this, and some people don't. And they get a therapist who judges them and kicks them out, and they spend a year wasting their time with somebody who yeah. So I mean, but that's just a terrible situation for a patient to be in.